today. I have mail today. Oh, man, I'm getting old.
Work, work, work. That's all they have me do. All the time, all days of the week.
Well, I'm retired, so.
Well, we all have me do, so. Anyway, what's up with you?
I planted flowers yesterday.
Well,
Guess which ones?
hydrangeas. Thought so.
Yep. Also, had the worst stomachache the other day. Had diarrhea and everything.
You did? Did you go to the doctor?
No, I didn't. I just think it was like a stomach bug or something like that.
Well, why not? Has it gone away?
Well, the thing is, I've been having like weird stomach aches for like the past like 1.5 months, which is like not normal for me because
Natalie, that's a long time. You should.
Yeah.
You should probably see someone about that.
should I?
Mm-hmm. It could be worse than you think. You never know. I would get it checked out.
Okay. I'll call my doctor then.
Hi Natalie, how are you?
I'm good. How are you?
So what's been going on?
Well, a few months ago, I started to notice that I was having a lot of stomach pain, but I just thought that it was part of like a stomach bug or something like that. But recently, it's been getting worse, and I've been having it more and more frequently.
Have you been out of the country lately?
No, I haven't.
Then what's your family history?
My dad has had colon cancer, and I've also had other family members who have suffered from cancer as well.
Have they had a history of heart disease?
Yes, one.
Have you tried any over-the-counter gas medicine?
Yes.
Have they worked?
No.
Have you been experiencing vomiting, diarrhea, or nausea this past couple of weeks?
I threw up a few times last week, but I just thought that it was associated with a stomach bug.
Were you experiencing any changes in your diet? Were you eating less, gaining weight?
I have been eating less, but that's because every time I do eat, I feel nauseous, and I think that's also why I'm losing weight.
How about fatigue? Have you felt more tired or just don't have any more energy, muscle aches?
Kind of. I just don't really feel like myself, really.
Did you have a fever when you were experiencing these symptoms?
Yes. Last week I had a fever of about 100 degrees.
Okay. After you ate, did you feel any additional abdominal pain?
I did notice that the pain got a little worse after I ate and when I would lie down too.
Did you have a problem with dehydration during this time? Any dizziness, dryness in the mouth, headaches?
No, I don't think so.
Are there any medical disabilities that I should be aware of?
No.
Okay, Natalie, if you would lay on the bed for me, we're going to do your physical examination next.
Okay.
I'm going to feel your stomach really quick. Does this hurt?
No.
Does this hurt?
A little bit.
Does this hurt?
No.
Okay, please sit up. Take a deep breath in and out. In and out. Okay, Natalie, there are many possible things that can be going on right now. You could either have pancreatitis, hepatitis, or a gallstone blockage. And I would also highly recommend you going to an oncologist. That doesn't mean that you have cancer, but we're just going to take precautionary measures right now.
Okay.
In the meantime, I'm going to prescribe you some pain medicine for your abdominal pain. I would also recommend changing your diet into a low-fat diet and to drink a lot of water during your time.
Okay. Thank you.
Thank you.
Hi, Natalie.
Natalie. My name is Dr. O'Brien. How are you today?
I'm doing good, a little nervous.
All right. I know it's a little hard being at the doctor, especially in oncology, so I'll try and put you at ease. So I'm going to go ahead and look at your blood test, and we're going to see what's going on. All right. So I see you have elevated CA19 levels, and this could indicate pancreatitis, possibly a common duct blockage in your pancreas, or colon or pancreatic cancer.
Cancer?
Yes, it is a possibility. I also see that in your primary care doctor's report that you're experiencing some symptoms, including abdominal discomfort and back pain. Is that getting any worse?
Yes.
All right. So I likely think that if we're looking at cancer, it's going to be pancreatic cancer.
What is pancreatic cancer?
So your pancreas is the gland located deep within your abdomen, and it releases enzymes to help with digestion. So in pancreatic cancer, when you get a tumor, it can block the ducts that let the enzymes get out and help you with digestion. So the tumor gets out of control and it could possibly metastasize, which means the cancer gets throughout your body rather than just local in your pancreas.
Okay, so what needs to happen for me to know if I do have cancer?
I would like to get you scheduled for a CT sometime within the next week. We would like to see if there's a tumor, if there's just a mass, and if there's anything else throughout your body.
Okay.
All right. I'll call you soon with the results after you have that scheduled, and we'll take it from there.
Okay, thank you.
Nice meeting you, Natalie.
You too, have a nice day.
Hi, doctor. You paged?
Yes. So here I have the results from Natalie Lima's CT scan.
Oh, great.
These were some of the pictures taken from the abdominal area. There seems to be a large mass on the pancreas, but it doesn't look like it has spread to any of the other organs.
Do you have the endoscopic ultrasound reports?
Yes. So it doesn't seem like the mass has metastasized, but it has affected some nearby lymph nodes and some major vessels, including the portal vein.
Thank you, Dr.
Thank
Glenn. I'll
you.
let the patient know.
Okay. Hello.
Hi, this is Dr. O'Brien.
Hi, Dr. O'Brien. How are you?
Good, how are you?
I'm doing okay.
Well, I have the results from your CT and your ultrasound.
Okay.
So there did show a mass on your pancreas, so we would like you to come back in for a biopsy to see if the mass is cancerous or benign.
Okay, when should I do that?
All right, I'll switch you over to scheduling to get that ready, but it should be in the next couple days.
Okay.
All right, bye, Natalie.
Bye.
Doctor, you paged?
Oh, yes. Are you Miss Natalie's doctor?
Yes.
Yes, the results of the biopsy are in. Great. Let's come review it.
Yes.
The results conclude that the patient has stage 3 locally advanced pancreatic adenocarcinoma.
Oh no.
So, as you can see, the cell size is substantially decreased. The nucleus of each cell seems to be darker and larger than usual, which is normal for this kind of cancer. It definitely indicates cancerous cells because the larger nuclei, it means too much DNA, especially with cancerous cells.
Thank you. Do you mind if I take the report?
Oh, sure.
Thank you, doctor.
Thank you.
Don't page again. Good morning, Natalie.
Good morning.
Unfortunately, I have some bad news to share with you. The biopsy we did last week came up as cancerous, and this is what we call pancreatic adenocarcinoma. It's a relatively large tumor, and it's begun to grow into your portal vein, which moves blood from your pancreas to your liver. And we saw this on your CT scan, so we also saw it spread to some lymph nodes nearby, but it's thankfully not metastatic, so no other organs have been affected.
So what stage of cancer would you call this?
We would call this stage 3.
Is that bad and will I live?
So because the tumor is found so late, as it often is with pancreatic cancer, the 5-year survival rate is 12% with people who have cancer similar to yours. Now, this number does not tell the whole story, so I don't want you to get too fed up with this. You have to just remember you have to fight through this. It's not all about numbers.
So where do I go from here?
Well, I've come up with a treatment plan for you if you're ready to review it. I know it's really tough for you to hear after the news. It's really hard to think. So if you need a few minutes, I can step out and I'll let you think.
Yeah, could I take a few minutes?
Yeah, of course. Just let me know when you're ready. Natalie, would you like to continue today?
Yeah, that's fine.
So first, I would recommend that you begin seeing a counselor to help relieve you of any struggles you experience throughout this process, because it can be a really rough one. And I know a really great one who all my patients praise of highly, and I'd be happy to set you up with her.
Okay.
All right, I'll refer you to her. So let's talk about your treatment plan. The most effective treatment for your type of cancer is a mixture between chemotherapy and external beam radiation therapy. So for your chemotherapy, we're going to use an anti-metabolite drug called fluorouracil, in addition to leucovorin, which is a folic acid, which will help the fluorouracil work.
How often will I be going to one of these?
So radiation is going to be 5 days a week for 6 weeks, and we're going to see how that goes. And at the same time, we're going to do chemo for 12 weeks, and it's going to be every 2 weeks during those 12 weeks. You're going to go a total of 6 times, and it's going to last 3 days every time you go.
So will I be able to go home in between these treatments?
Yes, so every time after infusion, you can go home, and we want you to rest after every infusion and after each time you have radiation. That's why you do radiation 5 days a week and not 7.
Okay. And will I still be able to work and do like all my other normal things?
Most people continue to work, and it's entirely up to you. I recommend explaining the situation to your boss and working on a plan. But exercise-wise, just take it slow. Don't go as hard as you used to.
Okay. Is this treatment my only option, or is there like a possibility that I could have surgery or something like that?
So because your tumor is so large and affects major blood vessels, it cannot be removed by surgery, as it could cause major complications and damage to necessary structures in your abdomen. There are other chemo drugs and other types of radiation that could be used. However, in my professional opinion, I believe that this method is going to be the most effective for you.
Will this treatment give me any side effects, and what will they be like?
So with this drug, fluorouracil, many patients do experience side effects, and these can include diarrhea, nausea, change of taste, mouth sores, low blood counts, and a few others that will be listed in your patient packet that I'll send home with you.
Am I going to lose my hair?
So not all patients lose their hair during chemo, and with the drug I'll be administering to you, most patients don't. If anything, they just experience hair thinning, but it's not that common.
Okay.
So do you have any other questions?
Yeah. So will the treatment be painful?
So the treatment itself isn't going to be as painful, but pancreatic cancer is a very painful disease, and we often prescribe medicine for pain management to help relieve you of that, and you can just let us know if that's what you'd like.
Okay, and what about money-wise? Because I don't think I'd be able to afford it if it's that expensive.
I'm going to bring you over to the insurance agent and help you figure out prices and payments. So I'm going to go ahead and give you this patient packet, and this will let you know all the other information you need to know, as well as some websites you can look at to help you, and the phone number to call the office if you think of any more questions. And I'll bring you over to the insurance agent now. If you'd follow me.
Hi, I'm Natalie.
Hi, I'm Michelle. Nice
Nice
to
to
meet
meet
you. I work in the insurance department here, and I'm going to help you look into prices and payments. So, would you like to get started?
Yes.
All right. So, what insurance do you have?
I don't have insurance.
Okay, so that's going to make it a little more difficult for your payments. But fortunately, the hospital does do a 30% off discount for uninsured and those paying in cash. So that's something we'll definitely look into, and we'll put it on your tab. I see that you have chemo and radiation, is that correct?
Yes.
All right. So each one of those you'll get a bill in the mail for. If the 30% off doesn't come out, then come back and see me and I can help fix that for you.
Okay.
Do you have any other questions for me, Natalie?
I don't think so.
All right. Well, you let me know if you figure out anything. Nice
Okay,
meeting
sorry,
you.
my hands are sweaty.
My hands are cold, so.
All right, Natalie, my name is Jenny. I'll be helping you with anything you need. Is there anything I can get for you?
No, I'm okay, thank you.
All right, well, first of all, I just want you to know this is a safe space. It's free from judgment, restraint, anything. You can tell me anything. So is there anything that's been bothering you lately?
I'm not sure. I really didn't expect to have cancer. I was just hoping I'd come to the doctor and get a diagnosis for like the cold or the flu. But now that I think about it more, it makes more sense because a lot of people in my family have had cancer, and it makes sense that I would have it too.
Yes, I understand. It's perfectly normal to feel shocked after your diagnosis. It's really hard to hear your name in the same sentence as cancer.
It is. It's different when it's like someone else and you're praying for them. But when it's actually your problem, it makes it so much worse.
I know. Have you felt any different because of it?
Not really.
I see. Have you felt out of control at all?
Of course I have. It's all that I think about and all that other people talk about. I don't know how to control it or if there's any hope for me at all.
I promise you there is hope for you. Have you sketched out a treatment plan with your oncologist?
Yes, she gave me a treatment plan.
Okay, that's great. Follow everything that she tells you to do. It's a little bit hard to grasp right now, but it might be a little bit easier after you have a schedule and a plan, and everything will be dealt with. Have you gone over it with her?
Yes. Well, we went over it at the office and I've already started it.
Great. Do you need help reviewing it at all?
No, I'm okay.
That's perfect. You're already doing so much better than some of my other patients. So that concludes our meeting for today. I will look forward to see you next week. It's very nice to meet you, Miss
Thank
Natalie.
you.
Hi Natalie, welcome back. Sorry about the location change. It was
That's okay.
last minute. Anyway, so what I want you to start with for our session today, I want you to tell me what your diagnosis is.
I have pancreatic cancer.
Can you say it again for me?
I have pancreatic cancer.
Very good. Can you tell me what that means to you?
I'm not sure yet. I just know how scary it is, and I feel like I don't have time left to do anything. Like if I have a week, a month, or I just feel so lost.
Can you tell me what brings you the most joy?
Probably my niece.
Perfect. Are you going to see her tomorrow?
Yes.
Are you doing anything else tomorrow?
I don't know. I have too much to do. I don't know how I'm going to cram everything in.
It's okay. I know everything's hectic right now, but we're just going to take it slow in slow steps. So what, if you didn't have anything to do, what would you do tomorrow?
Well, I'd be visiting my niece. I would wake up, brush my teeth, water my plants, talk with my friends, and probably go to the grocery store.
You have plants?
Yes, I love to plant flowers.
Me too! Which ones are your favorite?
I think hydrangeas.
Hydrangeas, I love them!
They're so pretty and the colors just make me really happy.
Oh, I know, me too. They're pretty easy to grow, right?
Yeah, actually.
See? It's nice to talk about something different, isn't it?
What?
Different from cancer.
Oh. Yeah, I didn't even notice.
I know it can be a little bit overwhelming when all you hear about is your diagnosis and it's all you talk about and all other people talk about. So, if you ever feel like anyone's obsessing over it or anything, if you just need to talk about something else, get away from it, please come talk to me. Anything will be fine. So, for right now, we're going to do something else, okay? So, I want you to say the same phrase that we said before. What's your diagnosis?
I have pancreatic cancer.
But now, this time, I want you to say, I have pancreatic cancer and.
I have pancreatic cancer and.
I'll say, I have pancreatic cancer and I'm going to see my niece tomorrow.
I have pancreatic cancer, and I'm going to see my niece tomorrow.
I have pancreatic cancer and I'm going to water my plants tomorrow.
I have pancreatic cancer, and I'm going to water my plants tomorrow.
Perfect. So that concludes our session for today. Just whenever you're thinking about being overwhelmed or you feel like you don't have any time left or anything like that, just take it in the little things, such as like what you're going to do tomorrow, so that you have hope in what you can see and what you can control. So, thank you, Natalie.
Thank you.
Very nice to see you.
Hi, how was school today? What'd you learn about?
Cats.
Cats?
That's what I'm reading in this book.
Really?
Yeah.
Who'd you play with at recess?
Jenna.
Jenna? Oh. So, Aunt Natalie has to talk to you about something really quick, okay? So, can you listen? So, you know how you always come to my house right after school? The bus drops you off here, and we always hang out and have a lot of fun?
Yeah.
Well, I'm gonna have more grown-up things to take care of now. I'm gonna be busier, and so you won't be able to come here as often. And your mommy already knows this. So this means that you'll probably have to go home with either mommy or daddy, okay?
Why?
It's just a grown-up situation, but I'll tell you about it once it gets over with. And I just haven't been feeling too well, and I've just been really busy. Okay? You promise me you'll be okay?
Yeah.
Okay. I love you.
Hello?
Hi.
Hi.
Where's my aunt?
Let's take a walk.
Okay.
Recently it's got. Sorry. It's because she's typing.
Raise up.
Hi, kids!
2, 1.
Oh, never mind. I forgot.
Oh God. Ah! Oh my.
I just thought that it was. Sorry.
Did you ever have a deluxe membership?
What? Sorry, I will just not.
Yeah, you just draw over there, Abby.
Should decide what are we doing grief counselor?
Dang it.
So what insurance do you have?
Geico.
Hello?
Hi. You can hear the voice on the other side.